The 10th anniversary of Regional Testing Day took place today across the Caribbean. In Belize, HIV testing stations were set up in 8 municipalities countrywide in an effort to get people, particularly men, to know their HIV status.
Belize is celebrating 6 years as a part of the program. This year is actually the first year we're doing 8 sites nationwide. So we're doing San Pedro, Corozal, Orange Walk, Belize City, Bemopan, San Ignacio, Dangriga, and PG. So it's a nationally coordinated activity today. It's from 9 to 3 o'clock at each site. And basically we're saying come out, know your status, get tested.
But the focus, from what we understand, remains the same, to try and get more men to come out and get tested.
Right. Our data in 2016 is still saying that out of the 32,000 tests done last year, 66% were women. So you only had 34% men. So you still have a big disparity in terms of the ratios. So we are prompting men to come out more.
As early as 9 a.m. today, residents made their way behind Scotiabank in Belize City to get tested. After going through a survey, they would undergo a quick test and learn their status on the spot. Kyle Miller says that it is dangerous not knowing your status.
As a young person, you should always know your status. It's always important to know your status than not to know your status. It's more dangerous to not knowing your status rather than knowing your status. So every time they have world testing there, or even any other testing, I always make sure that I go out and try to get my test done to know my status, to know more or less where I'm at. It's always been an issue whereby for getting men to go even to the hospital, to the clinics. I don't know, it's just part of this machismo thing whereby they think that men don't need to get tested, or if my girl go get tested, I could, or something like that. But no, it's always good for men to come out to get tested, to visit the hospital, the clinics, to get an overall general test.
The aim is to reach 0 new cases by 2020, but that goal might not be possible for several reasons, including all persons afflicted with the disease have not been tested. Over the past 5 years, the number of new cases annually has been constant, around 200 persons. While there was a dip in 2015, there is need for more interventions. Communications and Programs Officer at the National AIDS Commission, Arthur Usher, says that they've been going to male-dominated organizations to do testing.
The National AIDS Commission as a whole comprises of multiple agencies, and so when we're dealing with multiple activities at different levels, targeting different populations, and I think that's what most of the other organizations are doing. The BFLAs and the Ministry of Health and all these organizations, Go Hoven and all these places, and hand in hand, they're targeting and they're assisting in different areas and facets of the society. We actually got awarded for doing that regionally. Belize is the only country who has been doing that consistently for the past 4 years, which is 6 weeks prior to today. We've been testing throughout the country at male-dominated organizations. So this year we did police station, fire station, coast guards, we did like CPBL and some of the other construction sites and things like that. And we've been doing this since 2014.
Duane, Moody for News 5.